Hello, everybody. Welcome to another episode of Mondays with Moshe. This is Moshe Norman out of Lakewood, New Jersey. It is just 9 o'clock p.m. tonight, Monday night. We are at September 30th, 2024. Well into our 4.5 years of this show. And it's really been a wonderful, wonderful honor to meet so many prestigious, acclaimed innovators and professionals in the mental health field, both those who are presenting and those who are participating in the audience. So thank you to all of you who are participating, and thank you to all of you who are participating and have presented in the past. Tonight, I want to welcome our presenter, Dr. Andy Christensen of UCLA, professor of psychology at UCLA, which is in, can anyone guess? Los Angeles? Right? The LA gave it away. But what's confusing though? The IBCT, to not confuse it with ICBT. That we have to make sure not to confuse those. So actually the innovator of a form of modality of therapy for couples counseling called IBCT, or Integrative Behavioral Couple Therapy. For those of you who are struggling to memorize that, it's right there on your screen. So take a look, IBCT. And tonight, we are going to have the honor of learning a little bit about what that is, who it's for, who it's appropriate for, and how it works to facilitate better and improved relationships between couples. So without further ado, I would like to introduce Andy Christensen. Thank you for agreeing to do this talk tonight.
Thank you. I'm happy to be here.
Okay, and I do want to remind everybody that tonight's sponsors are OfficeStream.com. So don't forget. We always talk about the sponsor, OfficeStream. Take a look at the website while you're sitting on the show tonight, maybe listening in. Go take a look at their website, OfficeStream.com, because they're virtual secretaries who can save you so many hours a week that you can go back to doing your clinical work and don't have to be busy with some of the clerical work, and do what you really love doing as a mental health professional, which is mental health treatment and not paperwork. And of course, our sponsor, OKclarity.com. Take a look at OKclarity, because you can create a website on their site that will promote your work, your practice, and any other speaking engagements or activities that you do that you want people to know about. So take a look at OKclarity.com. Okay, Andy, tell us a little bit about who you are, where did you fall from, and how did IBCT become part of your life?
Okay, I grew up in a little immigrant community, an odd little immigrant community in Southeast Mississippi, a Danish community. A few Danish farmers got together and moved down there during the Depression. And I left right after high school and went to college in Iowa and then California, UC Santa Barbara, and graduate school at the University of Oregon. And I got interested in couples at the University of Oregon, and I got interested because of one of the founders of behavioral couple therapy, Robert Weiss, Bob Weiss, a very charismatic figure, and he supervised me, and I just got very interested in couple therapy. I continued that through my internship at Rutgers University in New Jersey. Speaking of New Jersey, Moshe. And then I got a position at UCLA and continued throughout my career, which is quite long now. I came to UCLA in 1976. And I've continued at UCLA since then and focused primarily on couples and families, but primarily on couples, focusing on couple conflict and couple therapy. I originally came, as I said, from a kind of a traditional behavioral approach to working with couples, but in collaboration with Neil Jacobson at the University of Washington, he and I both became a little bit disillusioned because of the data. The data showed that while a number of couples improved, up to 2/3 would improve, but then they would relapse. And so at long-term follow-up, you would have a much smaller group who still benefited. And there were some who didn't, respond at all. And so it seemed like the approach of behavioral couple therapy, while having some benefits, didn't really do as much for couples as we wanted. And then both of us kind of focused in on acceptance. Behavioral couple therapy is very much focused on change. Trying to negotiate, get couples to negotiate and come up with an agreement, who's going to do this and who's going to do that, and solve their problems with active problem solving. And we thought that needed to be balanced with emotional acceptance, and that led us kind of on a journey to create IBCT. We wrote the original book on IBCT in the late 90s. We got funding from the US government to examine it in the late 90s. We did a pilot study. And then we got a full-fledged clinical trial done both at the University of Washington and UCLA with a 5-year follow-up, which is the longest follow-up in the randomized control trial literature of couple therapy. And so that established the basis for IBCT. And so that's a brief overview of my journey of many years in developing and then continuing to train. Most of my recent work has been in training people in IBCT, because particularly the US Department of Veterans Affairs adopted IBCT as their evidence-based approach for couples in 2010.
Cool.
So since 2010, I've been actively working with VA colleagues to
Cool.
train therapists in the VA in IBCT. And as many of you may know, the VA is the largest healthcare and mental health care system in the country. There are VA facilities in every state, more than one in every state.
I noticed on your website that many of the trainings are for the VA.
Yeah,
On
exactly.
your website trainings.
Yeah. And we're trying to expand that to have training for non-VA therapists, but that's been the focus of my work for the last 15 years.
Amazing. So you're practicing since the 70s, which is
Exactly.
longer than most of us. I'm gonna look at this list. I'm gonna say almost everyone, almost all of us on this list are alive, including myself. I am not 50 just yet. But when we talk about titles such as integrative behavioral couple therapy, some titles can be tricky, because you're talking about now including or incorporating emotional work into the modality. And
Right.
can you just share with me or share with us, when you talk about integrative behavioral couple therapy, what does it mean that it's behavioral couple therapy?
Well, first of all, the integrative word means it's try to integrate strategies for promoting acceptance and strategies for promoting change.
Mm.
So that's the integrative part. The behavioral part is that that approach still relies on a fundamental social learning or traditional behavioral understanding of human interaction. And so that's the behavioral part. And then, of course, the couple part is we work with couples primarily jointly.
Mhm.
And the therapy part is we're hoping to improve their relationship.
I think the focus of my question was really on, when you talk about behavioral, does that mean that the therapist is giving the couple direct strategies in problem solving, or are they facilitating problem solving, or is there some, I always like to chide. I once worked with a couple many years ago who was not such a high functioning, at least emotionally, they were not a high functioning couple. And he was always very cold and she was always very hot. And so they agreed that they're going to switch off weeks, 1 week. And they did not get along very well, but they recognized that they had to come up with a plan. So they agreed on their own that 1 week they're going to keep the air conditioner on 69 and he's going to wear his sweater. And 1 week they're going to keep it on 71 and she's going to wear a light nightgown or something, to walk around the house. I always took some message out of this, that like even a lower functioning couple can come up with a solution. But what often we want to see in higher functioning couples is that you and I want to make each other happy, not that you and I
Right.
want to take from each other and then figure out, how to work that out. So, when you talk about behavioral, what does behavioral mean?
Well, because you're alluding to something, a common conception of behavioral that assumes that behavioral strategies are all direct change strategies, problem-solving
Mhm,
strategies.
mhm.
And a key notion in behavioral theory is that there's two kinds of changes that people can make. There's what we call rule-governed changes. So people make an agreement to follow a rule, or advise them to follow a rule of, one night you wear heavy clothes and air conditioning is up or down or whatever. So that's one strategy, and that's the most common strategy. But there's something in the behavioral literature called contingency shaped change. And what we mean by that is change that happens spontaneously in response to the circumstances. So if we let me follow the distinction a little bit. Rule governed are the shoulds and the ought tos in life. Contingency shaped change are the want tos and like tos and enjoy in life. And certainly you can make some progress with couples with, giving them, helping them solve a problem and come up with a rule of how they're going to solve it. But a lot of the issues that couples struggle with are not easily solved with rules, whether imposed by the therapist, why don't you guys try this, or whether imposed by the couple, they come to an agreement. And there, you're trying to, from an IBCT perspective, engage in what we call contingency shaped behavior, where we're trying to introduce new stimuli, and I'll say what I mean by that, that changes their emotional reactions or cognitive reactions. And what do I mean by changing stimuli? Let's imagine we'll say Jack and Jill. Jack is very controlling of Jill, she thinks, and Jill is very resistant to that. Okay, and they get into lots of battles about, don't control me, but you should do this, blah, blah, blah. Now, if we were able to facilitate a discussion that helped Jack talk about, for instance, his anxiety that leads to him to want to, let's say he's very concerned about security and he's, reminding her about keeping the doors locked and this and that and the other thing, and she thinks it's very excessive. But he starts talking to her about his fears and the nightmares he has about, how they might be broken into or harm caused. And then that may soften her, and then maybe she shares some things with him about, she just hates being told what to do or controlled, or someone breathing down her neck, and her mom used to breathe down her neck like this. But she also shares that she too is concerned about the safety of their household. And then the tone of the discussion has changed from why don't you do this? Why don't you quit controlling me kind of argument to a much more meaningful discussion. But it changed not because the therapist gave them new directions, but the therapist helped them expose new things, new feelings that they hadn't shared before, new thoughts that they hadn't shared before that maybe are more vulnerable. And so the therapist has to create a safe space where people can talk about those things. But that creates change in what we call, from a purely theoretical perspective, contingency shaped way. It's not coming from, this is the way you ought to talk to your partner. It's coming from us helping them say things and reveal things that they haven't revealed before, haven't regularly revealed, and it leads naturally and spontaneously
Hmm.
to a more meaningful conversation.
Is this what the old books used to call second order change? Was
It can be similar to second order change. I mean, the behavioral literature doesn't call it that, but
Mhm.
as you know, different
Everybody's got
theories,
their own
that
Lingo.
that refer to very similar
Mhm.
processes.
Okay, beautiful. That was actually very clearly explained, and
Okay, thank you.
appreciate that. I know you had some clips that you wanted to show, but just before that,
Sure.
in what way would you say IBCT is different than other forms of therapy? What are you either adding, incorporating, or minimizing that you feel isn't necessary than some of the other forms of couples counselors therapy?
I think there are several ways that IBCT is different. One is the conceptual framework that we use that I'm going to want to talk about. We talk about doing a deep analysis of a couple. And the DEEP is an acronym, but it's also meant to be in contrast to a shallow analysis of the couple problem. And the D stands for natural differences between people. And so partners are always going to have some natural differences. And what's interesting about those natural differences, as you therapists, I'm sure, are familiar with, sometimes the differences originally attracted them to each other.
Mhm.
And then there's some downsides to that, those differences as well, you know. So that's one thing. Then the first E is emotional sensitivities. So both partners carry with them from their past relationships or family of origin or whatever, they're sensitive, you know, so they may be more sensitive to abandonment, or they may have thin skin, sensitive to criticism, or are very, it's very painful for them to be ignored and not be kind of get the attention they want. So they're sensitivities, and that makes the differences much more provocative and emotionally volatile for them. And then you throw in the second E, which is the external stressors. And none of us typically do as well or you know, our best selves when we're really under a lot of stress. And so that can exacerbate the sensitivities, can sometimes polarize the differences. And then the final part of the deep analysis is the P, the patterns of interaction. Then couples get often stuck in a pattern of interaction that's meant to handle this problem created by their differences, sensitivities, and stressors. But the pattern of interaction they get into often doesn't solve the problem and, in fact, makes it worse. And then they get stuck in that pattern of interaction. And I'll be able to give some examples of that. So that's clearly one, I think, contribution of IBCT. The other contribution is that it brings together the integrated part, strategies for promoting acceptance with strategies for promoting change. So unlike traditional behavioral couple therapy, we have strategies for promoting acceptance. And unlike some approaches that really don't rely on some of the more straightforward problem-solving strategies, we can still use that. So those are a couple of the ways in which I see IBCT brings something
Okay,
new to the table.
beautiful, beautiful. Andy, would you share some clips, whether they're session clips or educational clips on IBCT, so we could get somewhat of a sense?
Sure. Okay. So this is a little clip based on my work with the VA, and it's a little cartoonish clip of 5 minutes, so it's very short, but it gives you an overview of IBCT, and it's meant for veterans to, you know, see, oh, this is a little bit what it's about, and to get them engaged and possibly coming in for therapy. So that's what I'm going to be sharing, this kind of cartoon clip
And
about
for
IBC.
those of you who can turn on your videos, we love to see people. For those of you who joined more recently, please. Thank you. Thanks, Aaron. Thanks, Faggy.
Okay, so uh, there we go.
In their early days together, you'd rarely find Doug and Emma apart. They were excited to take on life side by side, on land, by air, and at sea. But after several years of married life and mounting stress, things changed. They frequently disagreed and pushed each other to do things differently. Their family was slipping away, and they didn't know where to turn. until they learned about a new type of couples therapy called Integrative Behavioral Couples Therapy, or IBCT, that saved their friend's marriage. Doug and Emma liked that it's based on years of research and focuses on the underlying causes of relationship problems. They agreed to try it out. During the first few sessions, their therapist Carla helped them better understand their relationship. Carla asked about their relationship history, how they interacted, what was going well, and what wasn't. Although they agreed on the excitement of their early days, they each had their own views of what went wrong. Doug said Emma worries too much, always wants to talk, and needs everything perfect. Emma said Doug spends too much time alone, leaves all the housework to her, and never wants to talk or hear about her day. Plus, they don't have much time together anymore. During the fourth meeting, the feedback session, Carla summarized Doug and Emma's relationship using the Deep Understanding Framework. This explains a relationship based on differences between partners, like that Doug is introverted and needs alone time, whereas Emma prefers to talk about things. Emotional sensitivities. Doug grew up in a strict household and withdraws when he perceives criticism. Emma grew up in a chaotic house of 7 siblings, often feeling unheard, so she likes things to be in order, and she's sensitive to being ignored. External stresses, like growing debt, demanding jobs, and parenting, and patterns of communication for overcoming stress and differences, such as Emma's approaching behavior and Doug's retreating behavior, which creates a vicious cycle. Wow, this made real sense to Emma and Doug. They never considered their relationship's core issues. Just understanding made them more hopeful. Carla told Doug and Emma she thought they'd be great candidates for the active treatment phase. She recommended they start with just 4 sessions. Doug and Emma liked this plan. They worked with Carla to identify specific treatment goals based on their deep analysis. Focusing on incidents in their lives, Carla helped Emma and Doug become more accepting of each other. Doug realized his distancing behavior made Emma feel unheard and unimportant, like when she was a child. And Emma started to understand Doug's sensitivity to criticism and tendency to withdraw to avoid becoming aggressive, like his father. As they became more emotionally understanding of each other's behaviors, they blamed each other less, felt more connected, and made concrete plans to change how they interact. Carla helped Doug and Emma learn new ways of communicating. They learned to, first, watch their approach withdraw patterns. Second, to plan a time and place for talking in advance. Third, rather than attack or assign blame, to focus on how the incident made each of them feel. And fourth, to use listening skills so each felt understood. Practicing these steps in session helped Doug and Emma start putting them into action. Emma and Doug also planned more quality time with each other and Sadie, including a couple too many visits to the ice cream shop. They also added positive activities they could do alone, so it wasn't all on the relationship. After a total of 10 sessions, Doug and Emma have turned the corner in their marriage. They now understand each other better, and they're relating better to each other, not to mention feeling more emotionally connected. They've committed to continue their gains by watching how they interact and working to understand each other's deeper feelings. Though many days still have their challenges, they feel more confident and in control than they have in years. Just ask Sadie and old Roxy. If you're dealing with relationship problems, there is effective help available. Learn more about proven treatments and how to find help at treatmentworksforvets.org.
Okay, I think that little clip gives you a little cute overview of IBCT. And Moshe, I can, kind of do a few slides, or we can have discussion.
Well,
Just
yeah,
let.
I'm wondering, first of all, does anybody have any questions about the process? The first thing that comes to mind for me is I appreciate the conceptualization of what it is that we're looking to accomplish. I found that again to be very clear. Um, and I guess I wonder what happens when the relationship is more complex. And for instance, the couple doesn't let each other speak without jumping in and sharing. I want to share my history and why I am the way I am, or how I feel when you behave, and there becomes a lot of defense, offense, bicker. How do you get beyond that when one of them may have more complicated personality?
Well, from in the initial first session of IBCT, the first session is always a joint session, then followed by individual sessions with each partner.
Oh,
But in the very first session, we give them a message of, I want to find out what brings you to couple therapy, but rather than getting whole story from one of you or a lengthy story from one of you, I want to go back and forth very much to get a little piece from one of you, get the other's reaction to that, a little piece from the other, so I can see at each step of the way to what extent you agree or disagree or see things differently. So we try to set up from the very beginning that it's going to be an interaction and that we're going to hear from both of them. And if they have trouble following that, usually in the first session, it's very important because they're trying to be on their best behavior in front of the therapist. They want to impress, they don't want to look like a jerk in front of the therapist. And so we have a lot of control, much more control in the first session. So it's really important that we establish that. And also, if people are having trouble with it, we also quite clearly want to support that when they're doing well. And so saying things like, Jack, I use Jack and Jill because of the nursery rhyme as my examples all the time. Jack, I know that was hard to listen to Jill, but I appreciate you letting her kind of give her perspective on it. And now I want to hear your perspective on that point. So we try to set it up, support them in doing that. So we create this pattern of the therapist controlling the interaction. By
Hmm.
control, I mean the therapist is
Facilitating.
going back and forth between them.
And
And I might add something about that. When you have a volatile couple like you're talking about, Moshe, one of the big arts of couple therapy is the transition, how you transition from one person to the other. If one partner says some very blaming things about the other, you don't want to make a transition by well, Jill, Jack thinks you're really selfish and controlling. What do you think? That's obviously going to pull for all kind of defensiveness and counterattacking. So in making our transitions, we try to, first of all, when we stay with one partner, we try to go with what we call an IBCT, focus on the wound, not the arrow. People talk about the arrows that the other has shot at them, metaphorically speaking, and how sharp those arrows were and how the partner dipped them in poison before shooting them. But we want to focus on the wound because we can always sympathize with the wound without necessarily endorsing that the partner shot the arrows. And then when we transition from one partner to the other, we want to transition, obviously at an ideal time if we can, but transition in a way that leads into the wounds rather than a counterattacking of, well, yeah, he shot those arrows at me, but let me tell you, he says I shot those arrows, but I'm going to tell you all the arrows that he shot at me. So you try to interrupt that from the very beginning, but it's a challenge to your point, Moshe. It can be a challenge with very, very distressed couples. But let me say one other thing. The measure of success in couple therapy that we have in IBCT is that the couple can talk about difficult interactions in my presence or in the therapist's presence better than they can do it alone. And if in couple therapy, you're just watching them have the same dynamic, the same problematic dynamic that they usually have, which is their default. There's going to be, they're going to naturally go to having the same argument in front of you that they have outside of you. And we're always trying to see if we can help them have a more constructive discussion. And in the extreme case, if they get really upset and they're simply not able to have a positive discussion, what we will do in the extreme case is separate them. I mean, temporarily in the session. If we're doing it by Zoom, we'll ask them that one's going to be put in the waiting room, see the other one, see each of them alone, but then always bring them back together again. And then what usually we do is when I bring them back together again, and I've seen my share of really volatile couples, when I bring them back together again, what I do is I don't want to let them speak their piece. I'm going to be their spokesperson. So I'm going to say, I've heard each of you. And now I'm going to say in a way that I think the other person can hear what your concern is. And then I voice what partner A's concern is, and check it out with partner A, and I usually get confirmation of that. And for partners B concerned, because I can say it in a way that emphasizes the wound rather than the arrow, in a way that they can agree with.
Can you give an example of the distinction between focusing on the arrow versus focusing on the wound?
Well, let me give you an example of a couple that had that escalated to the point where I had to have them ask them to see them separately. And this was the man was had several adult children, I think 3 adult children, and he liked to visit them, and he liked to visit them with his new wife. She wasn't that new, but with his wife, for whom they had no children together. Okay. And so they would visit these adult children, and in those visits they were always difficult because wife felt totally left out and would get angry. She was like the fourth wheel when he's talking to his adult children or adult child that they were visiting. And he would get really frustrated that he couldn't have this special time because he didn't see his adult children that often, that he could be with his adult children. So that was the conflict. And but it deteriorated into, you're so selfish, you won't let me have some time with my kids, you just ignore me, you don't care about me, I'm last on the totem pole. You can imagine the kind of things that they were saying. And so I talked to each of them alone, and when I brought them together, I emphasized the wound. So I said, when I was speaking for him, and I was seeing them in person, and I kind of moved my chair over so like I was facing her, and close to him. I said, I really miss my children. I don't get to see them very often, and it's really important for me to be able to give them my attention when we're together with them. I don't want to ignore you. I don't try to ignore you, but I want to give them my first attention because I see them so rarely.
So in other words, and it's like those I statements where you're not focusing on what the spouse or what the wife is doing wrong as much as what your needs are. Is that what it is?
Exactly. That's, and then I go to her and not only her needs, but how she felt that, I feel so left out. I feel so ignored when I'm with you and your kids. I feel like I'm not important to you, that you don't notice me, and that I'm just not a part of this at all. Now that doesn't solve the problem, but they could hear that, and that calmed down the discussion. Again, it doesn't mean they're not going to have difficulties, but that's a way of dealing when it really escalates. And to your point, Moshe, I mean, when we make that, when I talk about what their reactions are, I am modeling a way of communicating that's not blaming and attacking, but focusing on needs or focusing on feelings and so forth.
Yeah, I find it amazing how our clients or patients will often, I guess, introject or, pick up our language that they learn from us. I often joke that so many of my clients can meet each other in the street and know that they're my clients because they'll have picked up little quips or, little nuances from the way I speak. And so they're challenging their own confidentiality.
Right.
Okay, any questions on what we learned so far? Please, if you do, use the reactions, or now it says react tab on the bottom of your screen, and raise your hand and we'll take them. Okay, Andy, how about if you share, I know you had some material to share. Let's take first a question from Michael, and then we can go to our material.
Okay.
So first of all, I really have enjoyed reading your book. I've read sections of it. I really enjoyed.
Is that
both.
is that the IBCT or the
Yeah, the reconcilable differences.
reconcilable differences?
Differences,
Yeah.
right.
Yeah, so I really enjoyed both the overview of the theory and also just a lot of what seems like just very common sense really applied to actual situations. So really, I enjoyed that. What I'm curious is, are there contraindications? So in other words, is there a way, are there cases where after an assessment phase, you'll kind of say, well, maybe they're better off not being together? Is there like a level of discernment? So that's one question. The other question that I had was simply trying to look at more education opportunities and supervision opportunities in IBCT, because I've been looking for that, but I haven't really found much out there because I'm not part of the VA.
Okay, all right. In terms of education opportunities, we're developing an on-demand training program in IBCT, video that consists of lectures, clips of real couples in IBCT and commentary on it, and that should be available through, I don't know if you've heard of PESI, P-E-S-I.
Yes, I know they are. Yeah.
Where they're going to probably be the first one to host that. And so that should be available early next year. You're welcome to email me and I can let you know when that's available and so forth. But that would be a way to learn about IBCT, because we've been trying to come up with ways to provide training for people who aren't in the VA.
And Andy, if you want some help with that, send me an email and maybe we could put together, a pilot group.
Oh, okay. That'd be great.
Between our 1,600 participants, maybe we can get some together.
All right, okay, that's right.
And maybe you can teach people not to be scared to work with couples.
Yeah, that's right. Because couples are challenging. Moshe and I were talking about Fritz Perls earlier on, and Fritz had a saying that he didn't like aboutism, where someone would come in and talk about their problems. He wanted to deal with it in the here and now. There's no problem with aboutism with couples, because they bring their problem with you. They're not talking about their problem, because their problem is right there in the interaction between the two of them. But Michael, I forgot, what was the first part of your
Sure. So the first part of it is, are there times when after you complete the assessment phase, you kind of come to the conclusion that they're better off perhaps not being together?
Right. The contraindications are, and then I'll address the larger question. The contraindications are intimate partner violence that is, dangerous. We can deal with low-level intimate partner violence, but anything that's dangerous and where people don't take responsibility and don't want to create a completely violence-free relationship, those are problems. Obviously, if there's suicidal ideation, that's serious and danger of suicide. Uncontrolled substance use can be a problem. So those are standard kind of contraindications. I mean, psychosis would be a contraindication as well. But in terms of us saying, you would better not be together, or announcing that, they shouldn't really be together. We don't really do that because I mean, unless the relationship is clearly dangerous for them, obviously then we would, or I mean, it's hard to say when, relationships can be both, build people up and tear them down, and I wouldn't want, I think it's an existential decision that everybody has to make about when you leave your partner, when you stay in. And so unless it's clearly destructive, I would never, I would help them think through that, but I would want them to always have that be their existential decision. And I would not want responsibility for that. And so in IBCT, we don't typically do that.
Thank you so much.
Yeah.
Appreciate it.
Okay. Any other questions before we jump into our slideshow? Okay, let's jump in.
All right, okay, let me share here. Right, okay. So just a quick overview of IBCT. We have an assessment phase, a joint session, 2 individual sessions. And during those individual sessions, that's when we assess intimate partner violence, affairs, things like that. Feedback session, that's when we provide the formulation, the deep analysis, and also outline treatment. Then active treatment is where we're actively working with the couple to improve their communication and as a result, help some of their core problems. And ideally, termination is spaced sessions. So that's the overview. We went over the deep analysis, so I don't think I need to go over that again, but that's our key conceptual formulation, the differences, emotional reactions, external circumstances, particularly stressors, and the patterns of interaction that often leave couples hopeless and helpless. They're stuck in their interaction patterns. And in the words of Dan Weil, an excellent late couple therapist and author, they become either adversaries or strangers with regard to that issue. Adversaries, they're fighting all the time about that issues, or strangers in the sense that they don't talk about that issue because it doesn't work when they talk about that issues, but they still think about it. They develop theories about why their partner is doing what they're doing. And, those theories are usually not particularly sympathetic with the partner. So that's what can happen. We provide feedback on their level of distress and commitment, their strengths, and then we outline the treatment plan. And the treatment plan here is, we go over the general goals, which are the differences and emotional sensitivities that people have. It's not that they can't change, but they're unlikely to change dramatically or quickly. And so acceptance is more the appropriate way to deal with the ongoing emotional sensitivities and differences. Stressors can sometimes be changed. Sometimes they have to be accepted because changing them, like quitting your job, that's stressful, would lead to even more stress. What we can always change is the pattern of interaction. And so that's the focus of treatment in terms of change. So that's the acceptance and change part of IBCT as it relates to the deep analysis. We can come up with specific goals, like they want to be, more cooperative parents, for example. So we can have specific goals as well as general goals. Our methods, we have what's called a weekly questionnaire where clients indicate, each one separately, the most positive interaction they had with each other. That's the plus there. The most negative or difficult interaction they had with each other. That's the negative, or the minus there. Any future issues that could be challenging. Maybe they're going to visit his parents and that's always complicated for them. or they're going to a party and her old boyfriend is going to be there, so that's going to be challenging. So they don't always have future challenging events, but when they do, we want them to list that. And then they can list any issues, even if there wasn't an incident. So they want to talk about their sexual relationship, even though there were no incidents of sex between the two of them, or even arguments about it. And then we're very active helping the couple talk about whether it be the positive incident, the negative incident, an upcoming challenging event, or some issue. We're active, and our goal is to help them have a constructive, meaningful discussion about it. The default position of a couple is always going to go toward their usual pattern of interaction. If their usual pattern of interaction is accusing and defending and counter-accusing, they'll go to that. Or if their usual pattern of interaction is one person shutting down and wanting to even leave. I've had a client, shut down and then he just wants to leave the session, that will happen in the session. So our goal is to help them have a better discussion than certainly they can have, and better means more meaningful. Where they, by meaningful, they're liable to reveal things maybe they haven't revealed so much before. They're willing to acknowledge parts of what their role in the interaction that they haven't been willing to acknowledge before. So things like that, to have a more meaningful, constructive interaction. And so the weekly questionnaire is the basis for that. And so that's basically an overview of the feedback session. And in the treatment phase, that's where we have these two mechanisms of change, Moshe, that I mentioned to you, deliberate change, rule governed behavior, the shoulds and that comes about with instructions or teaching or directions. And the problem with that is emotions and motives are often not congruent with that. My therapist can tell me, for example, as therapists often do, to use timeout if we get into a big fight, but the couples who need to use timeout the most
are the ones who are the least regulated to be able to incorporate it.
Exactly. And so that's the challenge of rule governed behavior.
I just can't believe that you have the same couples out in Los Angeles than we have here on the East Coast.
Yeah, I think they fly back and forth. I think that's it. They're bi-coastal couples.
Bi-coastal.
An evocative change, which is contingency shaped behaviors. It's the want tos, the feel likes, the naturally do's. We bring about by eliciting new behavior, eliciting new cognitions, new emotions. It's not easy to do that. It's not just obvious what's going to elicit, what are the conditions that will elicit a new response, but that's the strategy. Here are a couple of cartoons that illustrate this. Sure, I could tell you what I want you to do, but then you'd say it just because I told you to say it, so it wouldn't count.
Yeah, I have a problem with this. The couples say this all the time, and I don't find it to necessarily be true. Help me out with this, Andy, because how do you deal with this? I want you to apologize, but if I tell you to apologize, then you don't really mean that you're sorry. Or I want you to say it in this way, to ask me nicely, to ask me how I'm doing. But if I have to tell you to do that, then you obviously don't care about me.
Right.
And I sometimes try to make the argument that, or I try to have the spouse make the argument, but sometimes I make the argument that I may be sorry for what I did, yet I don't know how to apologize, or apologizing or expressing remorse is extremely triggering or uncomfortable for me. And if my spouse only asks me to do it or informs me that that's necessary or helpful for her, then I can do that for you because I care. Not, it's the contrary. Not that I can't do it because I don't care. I can't do it and I do care. Tell me when you need it and I'll do it.
Okay. I think what you're describing is one of the binds, I think, of rule governed behavior. So when partners say, apologize, and apologize like you mean it, even though I had to tell you to do it or you wouldn't have done it, so you probably don't mean it. It's a bind. And I would rather, I mean, or in IBCT, we try to not take the rule governed approach to that. So in that situation, I would try to get, let's say in this case, Jill to talk about more the hurt that she feels, more the what apologies do for her, how what she's yearning for in that. And I would get him to talk about, if Jack to talk about how difficult it is for him to make an apology, how he feels totally in a bind when she tells him to apologize, but then if he apologizes, then it won't count. And so sometimes it's really helpful to have a couple understand the unsolvable dilemma they're in. And interestingly enough, that sometimes softens the couple. So she doesn't put, in this example, push so hard to get an apology that won't be genuine. And he doesn't try to jump through hoops that are never going to be satisfying to her. And then he's going to be disappointed and angry that here I tried to do exactly what you asked, and now you're still unhappy with me.
So you're honing in on the process much more than the content, and rather than getting into a spat over the apology itself, let's step back from that and let's talk about the pain, which parenthetically causes me to need the apology, or let's talk about the fear, which parenthetically disables me from apologizing.
Exactly.
Beautiful. Beautiful.
And, if you want to save your marriage, tell each other you're sorry, and so they both tell you're sorry.
That's great.
Two types of changes we talk about. Traditional change is changing in the agent or perpetrator. Acceptance is modification of the recipient. I mean, victim and perpetrator in quotes. It's just, you know, if my wife is critical of me, then, you know, she's the perpetrator of that and I'm the victim. But we can change that by having her decrease her frequency, intensity, or duration of criticism, or I can change my reactivity to that. Now, what we want, and typically what we go for, is both kinds, and they go together. And so it becomes easier for me to be accepting if there's less intensity in the criticism. It's easier for her to be less intense if there's a willingness to hear the criticism. And so that's the combination that we try to go for in IBCT. Again, it's not easy, but this is the combination that we try to go for. Give me coffee to change the things I can, and wine to accept those that I cannot. I'm not asking you to change your spots, just asking you to take out the garbage. So just because we're accepting doesn't mean we can't also ask for change.
That's great.
So the key principles brings about emotional acceptance and behavior change primarily through evocative or contingency shaped change. Relies secondarily on rule governed change. And that goes to what you noticed, Moshe, just when I talked about the example you brought up of the apology. We first go to the evocative change. We first identify a core issue or issue. We develop a formulation, the deep analysis, and it points us toward what can be changed, what can be accepted, and kind of gives us guidance through that. Here's the book on IBCT, the most recent one, 2020. That's the Therapist Guide. Here's the second edition of Reconcilable Differences. But I want to take just a few minutes to tell you something else. The ourrelationship.com program is an online program. About 8 to 10 hours of digital content done over 4 to 6 weeks, done self-directed or with a coach. It has various programs for different kinds of couples. The Our structure and Our relationship, in phase 1, they identify a core problem. In each of the phases, they do work on their own with the computer and then come together and share that. Once they've identified 1 or 2 core problems, then they go through the understand phase where individually each of them comes up with a deep analysis of those 1 or 2 core problems. And at the end of the understand phase, they share that with each other. Then the respond phase is they try to establish a plan of how they're going to move forward and try to talk to each other differently, interact differently, to try to make progress on these core problems.
So wait, let me just clarify. This hour structure is, this is the online course?
Yes,
Oh, I see.
the
30-minute
online course. And it can be done on a computer. It can be done on a smartphone like here. It is been studied for over 15 years with federal grant support. And as a result of that, we have a grant. It's available for low-income couples for free. We have an agreement and contract with the military. All active duty personnel can use this program with a coach for free.
Wow. Low-income families, this is for veterans you're talking about?
But these are for active duty.
And
For
the low-income families is
Low-
only for veterans?
No, I mean, anybody can use it, but in terms of, there are 2 options for getting it for free, including with a coach. The coach, by the way, there are 4 or 5 coach calls, usually after each of the phases of the UNR. But the people who can get it for free can either do it through our grant-supported program where they participate in the research. Those are low-income couples or any veteran couple. Now, active duty personnel can do it for free and don't have to participate in any research. It's not part of the research. It's part of one of the benefits they get for serving in the military. And also, I mean, it's all services in the military, and even for the first year that they're a vet. In other words, for the first year that they're have left the military. So it's available for free. It's also available for a fee for people who don't meet those criteria. Not very expensive. It's like $100 for the no coach condition, and about $250 for with the coach. And what I would suggest is that it's really good as a supplement to couple therapy, as before beginning couple therapy, or as a self-help program. If a couple can't afford couple therapy, that's a good alternative. If they're not ready for couple therapy and want to try something on their own, they can try that. So I think these are 3 ways that you might be interested in considering that program. And just I'll finish up now here with the resources in IBCT. There's the book on IBCT, the Therapist Manual, the self-help book that Michael, you mentioned, Reconcilable Differences. There's the online program, ourrelationship.com. There's an IBCT website. It's now through UCLA, but it will be just as you see in my background, ibct.org. That's the new website we'll be using to get it away from UCLA. And there's some demonstration tapes of IBCT through the American Psychological Association.
Cool.
So anyway, I have given you a quick and dirty overview of IBCT. So hopefully you have a little bit of an idea of what it's about, and I'm happy to answer questions.
Does anyone have any questions or comments about what was just covered? Because that was a lot of content, very compact. If you do, please raise your hand using the React tab on the bottom. And I want to ask you a question about some of the patterns that you see in treating couples. What are some dominant, I guess if we look at a couple, we can see a million different details, or we can see relationship patterns. What are some of the thematic patterns that you see recurring in couples that you treat?
Okay. Let me look at it in terms of, first of all, the patterns of communication. So one of the most common patterns we see in the veteran population, but also in the non-veteran population, is what we call the demand withdraw or push withdraw, pursue distance withdraw, of one partner wanting to talk about it, let's discuss it, the other partner not wanting to talk about it, fearing that the talk about it is going to be, critical and they're going to get defensive. And so that's a very common pattern. Another extremely common pattern is well, let me back up a little bit. The famous psychoanalyst Karen Horney talked about 3 ways of relating interpersonally: moving against, moving away from, and the third one was moving toward. That's positive. And then there's also, we put in moving away, moving toward anxiously. And so moving against is, arguing, fighting, competing, that kind of stuff. So a very common pattern is 2 people just getting into arguments all the time. The other common pattern that I just mentioned is one person moving against and one person moving away. And you saw that in the little cartoon example. One of the patterns I find very interesting, but it's not that common, is when both partners move away. They don't bring up anything, so things are always under the rug. Everything is indirect, and they have difficulty dealing with problems.
Those are cases of tremendous shame, aren't they? There's
Well,
so much.
they can be. I mean, they can be also influenced by culture. I've worked with some cultures where just talking directly about your feelings and your concerns is not the way you deal with it. It has to, it's more of a cultural thing of being indirect, but it certainly can be from shame. Exactly. And it can also be from, we tried talking about it, it never went well. And
Yeah,
so
that's what I mean by shame. Like this has failed. We've failed each other so miserably that I'm ashamed from you and you're ashamed from me, and I'm ashamed of myself and you're ashamed of yourself.
Right. Yeah. We failed so miserably. Why even try? Exactly.
So we have the pursue withdraw dynamic.
The both moving against each other, both moving away from each other. There's also a more pursue anxiously. Someone this is usually in a trust issue. So I'm checking up on you. I'm kind of looking at your ask you where you've been, who are you talking to on the phone, not giving you much privacy because I'm really concerned that what you might be doing, when
Like
I'm
an anxious attachment style.
Exactly.
I'm wondering, you've been treating couples for so many years. And I just have to give a shout out to Aaron Herzog. I see he's on, and he made this connection, and I'm so glad that he did, because this has been such an insightful talk. So thank you, Aaron, for bringing Andy and so many other professionals that you've brought in. And I'm wondering, Andy, over the past 50 years, have you seen a shift or a change in some of the challenges that couples bring to the therapy room? Something that's identifiable. You don't have to answer. It doesn't have to have been, but I'm curious.
Yeah, no, but first of all, it hasn't been actually 50 years, but but it's getting awfully close to 50 years. But I like to round down, Moshe, rather than rounding
There's
up.
a certain point
we
where
older folks like to round down, but anyway, the details have certainly shifted. And early on, there was never texting each other, and now couples come in and when they disagree with each other, they want to provide the evidence. Well, no, but I'll show you the text of what he said, or I'll show you the text of what she said. No, you didn't say that. We didn't have that kind of documentation. Or some people say, no, I did call you that night, and here, let me show you on my phone. So there's some details that certainly have changed because of primarily the introduction of technology, and new problems have developed because of the introduction of technology.
Mhm.
You know, things like the availability of porn, the availability of virtual worlds. Maybe some of you've heard of Second Life, where you have an avatar and you live in a 3D world, and your avatar can do all kind of things, including have an affair with another avatar. So this is new material that we didn't have to deal with 40 years ago,
Mhm.
or 30 years ago.
Do you ever find that an advantage to the ability to text? There's couples who would have otherwise stonewalled each other, let's just say, and they find to in spite of the fact that it's often a detriment to not engage face to face, but do you find that to be a nice medium sometimes that they can engage through text in where they otherwise would not have engaged at all?
But it certainly can be. It's like it's like any other technology can be used, or most other technology can be used for good or ill. So it can be a good way to
Mhm.
connect. And sometimes couples, I've had couples that try to, bring up controversial issues on text or email, because they both then have a little more time to think about it and respond to it. And so that's an
And keep their
example.
cool and respond more even keeled or more mindfully.
Yeah,
Interesting.
so that's certainly an example of that. But I've certainly had many cases where people can be as mean on text as they are
Yeah,
are in person, and
indeed.
and
And that's
then
besides all the miscommunications, that I mean, when the husband does it, it would be, I guess, a Mr. communication. But
uh,
the miscommunications that take place without the proper use of emojis.
right. No, and sometimes people don't know, if this was said harshly, because it was so short, or if it was just because the other person was really busy and, dashed off something that didn't seem very kind, or um, so there, it can have good or bad, like
Yeah.
so many things.
Okay. Any other questions from the participants? And Andy, is there anything else you'd like to add or share with us? Any websites or resources or any information or main points, that you feel you want to add
Okay.
so far?
Well, I think the big thing I would like to emphasize is, assuming you, as I do, have people who are, one partner's not ready for couple therapy, or therapy is too expensive. I think the ourrelationship.com, I would encourage you to go on the website. If we'd had more time, I would just show you the website and show you a little bit about it. But I would
We can do
encourage you to
that.
go on the website and look at it, because I think it's an alternative for couples who can't afford very much or aren't ready for couple therapy, or even as they're going through couple therapy. It's a real benefit for them, and many of them large portions can get it for free.
Well, let's take a look at that because I think it is important. We do have so many, low income clients. So many of us have low income clients, and I think it'll be a great resource. So why don't we take a
All right,
look at it?
all right,
Uh,
I'll share it with you.
okay, go ahead.
So here's, you can see the ourrelationship.com. I'll go down here. Our program is tailored to your needs. It's guided or self-directed. It's on your schedule. Multiple programs to meet the needs of all couples. So we have it for heterosexual couples, LGBTQ plus couples, military couples, and individuals. It's backed by more than a decade of research, 15 plus years of federally funded research. You can view the evidence. Let's go to the military and veteran couples. And it's offered freely through Military One Source, which is a major section of the military that provides benefits for couples. So active duty or separated within the previous year, Guard, reserves, enrolled in a military academy or ROTC program. And we can learn more about that. It can be done, with a coach. First step to a better relationship. Its services operated through the Defense Department Military One Source program. So if you have any military couples, I would, certainly encourage you to look at that. So here's how it would work. You select a program, pick the program that best meets your needs, and decide whether to complete it with or without a coach. Let me say something about the coaches. All our coaches, for the most part, are in training programs in mental health. They're not therapists, and this is explicitly not therapy.
Oh.
And these are typically 20-minute calls at 5 spots during the program to get them oriented to the program. And after each of the phases, the O phase, observe, select a core issue. The U phase, understand the problem with the deep analysis. And the R phase, come up with a plan of dealing with it. So the coach meets them after each of those phases and helps them process a little bit, did it work, suggest, answers any technical questions, and encourages them to, if it didn't help, if they had a real problem with it, and gives them some alternatives. Once you've you've signed up with a relationship coach, you schedule your first coaching session. And again, remember, people do a lot of it alone. So each of you in each phase, each partner works independently, like in the U phase, to come up with their own deep analysis of the 1 or 2 core problems. And then at the end, the program brings them together to share that. And when I say the program does this, it's like you and your partner are sitting there with your on your computer screen or on your smartphone, and the smartphone says to me, Andy, share with your wife, Louise, that's my wife, the key differences you think are related to this core problem you mentioned of X. And so I list them, and then it'll have Louise list what she put down there. And so it kind of goes back and forth, but the phone is working as the therapist to try to guide us and keep us from interrupting each other and going back and forth. So that's the conversation that you have at the end of each phase, but before you have the coach call. You do this over the course of 4 to 6 weeks. And as I said, we can go back to, let's go back to the evidence. And let's see where I'm going to go back to the evidence. We have a lot of evidence. We can created by experts, backed by research, the types of changes, and these were the studies we did. We've done studies on over 2,000 or 3,000 couples, and we did one study on a nationally representative sample of American couples. We did one on minority, on low-income couples. They had to be within, I think, 130% of the poverty line. Maybe it's higher. We've worked with military couples, minority couples, and generally, not everybody, of course, improves, but overall, fewer communication problems and arguments, less emotional distance, improved trust, recovery from infidelity, fewer fights about money. So these are some of the evidence that we have. And if any of you are interested, you can go on the website and you can it will take you to some of the particular detailed scientific articles.
Amazing. Wow. This is a terrific resource that I wish I would have known about, and I hope that I can share with some of the needy couples. I actually would love to check it out myself, to take a look at how that program runs and what it's like to be, you know, a participant in it. So maybe we could figure out how to do that. Okay, any last questions from the participants before we log off and call it a night? I know it's still early in Los Angeles.
Yeah.
Go ahead, Shane.
Yeah, I just want to say thank you so much. It was so informative, amazing information. I am actually in a few programs from couples therapy. You know, I do the RLT and, you know, Ellen Bader, and really, I'm really impressed with your program. So thank you so much. And thank you, Moshe, for bringing Andrew.
You're
Well, thank you. I appreciate that.
Yeah, thank you.
A lot of nice feedback. Okay. All right. Well, let's call it a night. And thank you again, Integrative Behavioral Couple Therapy, Dr. Andy Christensen. Good luck, and let's stay in contact.
All right. Sounds good.
Good night. Bye-bye.
Take care, everyone. Bye-bye.
Bye.
Bye.
Okay.